Hello, my name is Michelle Stone, and this is my capstone and 5-year plan presentation. I graduated from South Plains Vocational School of Nursing in 2002. I worked as a licensed vocational nurse for 7 years. I later went on to attend the transition program at South Plains School of Nursing, where I received my associate's degree in August of 2009. I am currently finishing my baccalaureate degree in nursing and will graduate in December of 2019. I work as a staff nurse and relief charge nurse in labor and delivery. In 2016, I obtained my national certification in inpatient obstetrics. Throughout the RN to BSN program, we're required to meet certain learning objectives. Student learning objective number 1 is to practice safe and effective holistic patient-centered care to a variety of patients and clients in multiple settings from a global perspective by incorporating different theories and evidence-based findings. I met this objective in Comprehensive Holistic Health Assessment Nursing 4316. In this course, I was required to perform multiple assessments on patients in a computerized simulation setting. This allowed me to listen to different sounds that I would be hearing in the assessment and how to distinguish normal sounds from abnormal findings. I thoroughly enjoyed this class and feel as though I met this objective 100%. The interactive setting was extremely beneficial to my practice. Student learning objectives number 2 and 3 were to evaluate patient-centered care for patients and clients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health, and to support patients and clients in preventing disease, maintaining wellness, prompting and restoring health, and advocating for death with dignity. I met both of these objectives in Nursing 4620, Compromised Multiple Health States. In this class, I read the memoir, Why I Wore Lipstick to My Mastectomy, and I was able to interview an individual with the same health state. The individual that I interviewed happened to be a highly respected physician that I worked with, and the insight I gained from her was very beneficial. I also met this objective throughout this course by discussing different disease processes and the systems that each one affects. I met the requirements of this objective by scoring a 96% in the course. I was also able to interview a patient with diabetes. I discussed the patient's feelings and how she received the assistance that she needed. I was able to interview different resources available in the community and figure out ways that this information could become more easily available to the public. I successfully met this objective by scoring a 98% on my community-based service learning activity. Student learning objective number 4 was synthesizes clinical and judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. I met this objective in evidence-based practice in Inquiry Nursing 4391. I researched a quantitative research article and elaborated on the article and how it met the qualifications for that assignment. I was also required to do a qualitative research study as a group assignment. We worked individually and then brought our information together as a group to meet the required objectives. Student learning objective number 5 is employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients, clients, and members of the intraprofessional and intra-professional healthcare team. Nursing Theories, Nursing 4321 is the course that helps me meet this objective. The philosophy paper allowed me the opportunity to research different nursing theorists and how they applied to the nursing meta paradigm. This course also used focused insight essay questions that were relevant to the course material and the different nursing theories. I was required to write a paper on differentiated essential competencies and how they can promote patient safety. This outcome was met with a 95% in the course. Student learning objectives number 6 and 7, to differentiate multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients and clients as a member of the interprofessional and intraprofessional healthcare team. Demonstrate professional integrity, effective communication, active inquiry, and service to the community. The course that allowed me to meet these objectives were Leadership Management in the Healthcare System, Nursing 4550, and Care of Communities, Nursing 4540. In Nursing 4550, I was able to come up with a plan of action to help decrease the number of post-op infections after a C-section by requiring that all personnel that is staffed in the OR that day perform a 3-minute sterile scrub. And the RN that is assigned to catch the newborn in the OR would also don sterile gloves and gowns before receiving the newborn from the physician. I also wrote a paper on effective leadership and qualities that individual needed in order to be an effective leader. In this course, I also had to research different global health organizations and create a PowerPoint on one that was pertinent to my area of practice. I chose the International Childbirth Education Association. I met this objective with an overall score of 96%. In Nursing 4540, I was able to explore nursing and the impact that it has on the community. I was able to read about several different historical nurses and the roles that they had within the community. I wrote a paper that discussed the healthcare system and the financial effect that it has. My favorite part of this class was the work that I did with a local organization called Shelby's Bridge. It is a nonprofit organization that is helping adults with disabilities become independent and function within society. It's helping them learn how to live independently and how to hold down a job. They are looking to build a tiny community of about 20 houses in Beulah, Texas. And with them having this small community, I thought it would be beneficial for the individuals to come up with a plan of action in the event of a disaster and that they needed to seek help immediately. My 5-year career plan. Ideally, I would like to transition from a relieved charge nurse role to a full-time charge nurse position. Since I already have my inpatient obstetric national certification, my next goal would be to obtain my national certification in electronic fetal monitoring. It is a subspecialty certification, and since I am an intermediate fetal monitoring instructor, I think it would be beneficial for me to have this certification. That is also one of my other goals, is I would like to continue teaching IFM to the staff that I work with, and then also reach out to other community hospitals in the area.